Thank you so much. So, what I also like to do is that once I give them a diagnosis, then I have a board, the whiteboard. So, actually, I write the diagnosis for them, I draw pictures, and then I tell them to take a picture of that, what I made. Because this is another thing. We forget 60% of information by the time you leave the doctor's office and get into your car, you have lost 60% of the information.
I can vouch for that.
So, if I, so you have to draw pictures and give them the chance to take a picture, keep it so that they can go back and say, oh yeah, he said this, he said that. Yeah, we can, and share it with other family members. So that's another thing that the doctors need to know. The patient's going to forget a lot of stuff. I don't mind people doing what they say, doctor Googling or chat GPTing, and then they get information, and which is all I recommend doing it. So you learn and you ask the right question. But we need to know that we have to confirm things with the physician, right? You cannot depend on Dr. Google and ChatGPT to make your diagnosis.
ChatGPT is a good sounding board for, I think I have this, and these are the symptoms I'm having. What are the questions I should ask my doctor? That'd be really good use of ChatGPT just for the guidance on what to ask.
Yes.
Not asking it to diagnose, because it is not a doctor. Ultimately, you do need the doctor.
Right. So if there is any oversight or something, you can still bring doctor that, is it possible that I have this condition? And I'm telling you from examples, a 15-year-old girl walks into my clinic and she says, doctor, I think I have this condition. And I'm like, how? She said, I did all the research, I put in the chat GPT, this is the condition, this is that. So I sit with her, I examine everything, I go through the test and stuff, and she was 100% right. That's exactly was her diagnosis.
And I feel like people usually do have a good instinct about what's going on with their body.
Yeah.
ChatGPT aside, Google aside, people usually have a pretty good instinct about what's going on with them. But I was amazed even with that, and I think it's a good thing that when a patient calls in to schedule with their doctor, even though they're telling me I have the flu or I have this specific thing, we don't ever put that they have that specific thing. We ask, what are your symptoms? And that's what we put in the appointment note.
Exactly.
That's what we do. I'm sure the doctor doesn't want to have that preconceived notion. Doctor needs to know, these are your symptoms, and am I going to arrive at that conclusion too? Or am I going to go, no, actually, it's this over here. I think that's very wise that it is the symptoms and not it's this diagnosis that I have decided myself that I have.
Correct. And the most important thing was also to know that every time you have lab tests, if it says abnormal, they said don't take it to heart. Let the doctor look at it, and then I look at it and I say not unremarkable or nothing special, and then they are relieved. The lab is designed to just churn up even 0.1 or 0.2 variation, it's going to say abnormal. But if you've seen enough cases,
I would even think the more medications
if you've seen enough cases, then
the more abnormal results you're going to get, because it's changing your body chemistry. I mean, is that right?
That's right. That's right. Sometimes you can have some abnormality, but it's just a variation. Like we all have some variations, right? So if they say that, your number should be 12.5 to 13.5, but if you are 13.8, but I've seen even 14. So that is why the experience counts. If you've seen so much over 30 years, then you know what to worry about and what to ignore. So that is how it's done. But I also like the patient should use more portal to connect with the physician directly also. That is also very important now, and it's happening more and more. Patients can ask questions directly to the doctor through the portal. I think all these changes are remarkable.
It's a nice resource, and it's an amazing thing that people have greater access now to their doctor than ever before. Even the fact that they could even do a video visit, assuming that their insurance allows them to do a video visit.
Oh, yes. No, video visits have changed because now you can do more of those. And you don't have to wait 3 months for follow-up. Within 3 to 4 weeks, you can do a quick video visit with your doctor. And I think multiple visits make sense because, one time you see and the doctor says come back in a year, I think that's not the right practice. If you have symptoms, you're giving them some medicine, you should see them more frequently. So part of it is also but if as patients, if you are not proactive, you will get tremendous difficulties. The system is still archaic. navigating through through this whole complex of medical care is very, very difficult. As a patient, sometimes I felt myself going through so much, and I still feel the system is so archaic. If I am not proactive, things are not going to move, and they're not going into the right direction.
And it's a combination. Some of it is the, medical practice itself, but I think a larger part of it is all the hoops that the insurance adds to it. There's so many
Correct.
hard stops and extra hoops to jump because, oh, the insurance won't cover this, but if you jump this hoop, this hoop, this hoop, and maybe the insurance will cover it, or they'll say, nope, you can do this instead. And I don't think people realize to what extent insurance controls things.
Yes, it definitely plays a very strong part in doctors' decision-making process. But again, I'm telling you that you, for example, Zoe, like if you go to your doctor, you're going to say, if you know that your condition needs special care, you have to ask your primary care doctor, is the dietitian available to me, doctor? Can you refer me to? Is the GI available for me? Because I think these symptoms are bothering me and I'm concerned. I want a gastroenterology referral. I want a dietitian referral. I want a psychologist referral. If you are not saying, this proactively, you're going to sit. The primary care is going to see you, give you a prescription, tell you to come back in 6 months. 6 months have gone by, another 6 months have gone by, another. And you're suffering through the whole process. When a gastroenterologist could have easily done an endoscopy, colonoscopy, and if there's a diagnosis to be made, done it and solved it. Time and time again, patients are coming and telling me, I wish I was referred earlier.
So that's not going to happen automatically.
I wish I was referred to it. And that's the problem.
Primary care physician is not going to say, hey, I think you need to see a gastroenterologist because of these symptoms. They're going to try to, like my doctor said, well, we know that you need to lose weight. You're aware of that already. Here are some book resources, some research for you. And that's where we left it. So
right. So let me tell you something. So now everybody's on these GLP-1 agonists, right? Because of the weight and all that. But we still have some older weight losing for weight loss medications like Orlistat. But nobody's mentioning them. Why not? By reducing fat absorption, those medicines in the past, they were being used. Yes, you have to consider the side effects, you have to consider everything. But if Ozempic is not covered, if Wegovy and these are not GLP-1 agonists are not covered by insurance, there are other cheaper medicines which previously people have tried. If they can help you, if probiotics and prebiotics and Metamucil can help you, why are people not talking about these other ways of doing things?
They're focused on the flavor.
Right? And so unless we know, we have to ask these things. So the incentive sometimes for the primary care physician is to not make too many referrals. If that is an incentive, it's counterproductive to you as patient. Correct? If they're looking at the doctors, primary care physician as gatekeepers who are not raising the healthcare cost by reducing referrals to subspecialists, by reducing imaging studies, by reducing, extra CTs and MRIs, then as a patient, unless you ask, unless you are strongly advocating for yourself, you are not going to move forward.
So that's good to know, because I've always, if I needed a referral, my doctor would simply refer me to where I needed to go. But that's not the case.
That is what is not gonna happen. Okay. No, it's not gonna happen. It's then depends on that primary care physician's own understanding of himself or herself. If they are humble enough to know that this is beyond them early on, then they would refer earlier. They should do what ethically is the right and morally is the right thing to do. But unfortunately, that's not what they are compensated for.
It may even be.
So there is an inner conflict. Yes, that is right. You are dinged for doing extra referrals.
I could see where that could be.
So it's against that can be important. So if you know to ask, that is why I want people to be very educated about this. And I've made a lot of reels on Instagram about it. That look, ask this question, ask this question, ask this question. If you have these symptoms, these are the possibilities. If the doctor is telling you you have irritable bowels, you can ask, have we excluded celiac disease, doctor? Can we do that before we label it IBS? And some doctors can forget about that. I may not even have considered, it would be an oversight. But if you are well read, if you know, you can ask the doctor to get things done.
my goal had been just to kind of help our audience understand your credentials and maybe learn a little bit myself, of course. But I have to tell you, even though I'd heard, the terms prebiotic and probiotic, I never fully understood the prebiotic terms before you explained these to me. So I think that's maybe something I've been missing out on all this time. So it's almost like I've been using baking soda without using the vinegar as the catalyst. In my head, that's kind of what the picture I'm missing, where that would be like a powerful cleansing agent type of thing.
Right. And the diversity. This is another thing I often question. You have 100 species of bananas, and all we eat is the Cavendish Chiquita bananas. So there are baby bananas, there are purple bananas, there are plantains. All of this, the more diverse your food is, the more colorful your food is, the more good bacteria is going to engage, more diversified and active and healthy gut bacteria you're going to have, right? And that will determine your fate, your weight, your heart condition, your blood pressure, sugar, and your colon health. One handful of nuts and seeds every day, just a fist, will prevent you from getting colon cancers, reducing the risk by 20%. And only 11% of Americans get the handful of seeds and nuts every day.
Absolutely. My ex-husband used to.
So you know what prevents cancer, but you don't want to do it.
Exactly. I mean, I used to watch him eat this way naturally. I thought, he did it just because that was normal for him. But that explains why he was always so bone skinny. He was already eating all these ways that you're talking about. That was his normal diet. He was born and raised in Ecuador, and that was how he grew up eating. And
a lot to learn from it. My biggest concern now, for which I have applied for a big grant for rural support, is childhood obesity. And with obesity, children are getting fatty liver disease, type 2 diabetes, metabolic dysfunction. All of this is happening, and it's like pandemic kind of a situation. So we have to create a culture where it's an easy access for nuts and seeds and difficult access for chips and cookies and crackers and other processed food. So if you look at different cultures, like, if you go to Emirates, for example, if you go to their homes, even in like some Asian countries, on the coffee table, you have all these different kind of nuts sitting there. So if children are raised in that kind of home where it's very easy to get your hands on fruits, vegetables, and nuts and seeds, then they will not open up these packages, right, of cookies and crackers and chips and all that. So how easy you make things for people is what will determine their habit and behavior.
That's an excellent point. I grew up in a house with 5 kids, so money was tight for my parents. But I'll tell you, we had plenty of oranges and peanuts, and those are mainly what I remember eating as snacks as kids. We had lots of fruit and lots of nuts because they were cheap.
Wonderful. Right. And eating always with the greens first will also reduce your other caloric intense food, right? That's the reason why Metamucil and greens, they're going to fill you up enough that you're natural. And the most important thing is also chewing a lot. So if you chew food long enough, you get more and more satisfaction out of smaller amounts. So these are some of the things you can do. And also beware of innocent looking natural juices.
Oh, yeah, I don't touch juices.
They're not innocent.
They're full of sugar.
They're not innocent. Yeah, it's and sugar is the main culprit that increases the weight eventually. So
I only
there was some
with pizza on rare occasions, and I don't do juices at all.
And the other important thing, Zoe, is that to know that with people go with the diet drinks, right? But they are more dangerous to you because they themselves can cause obesity. Even if they are sugar-free, because it creates the craving more for real sugar. Because you try to trick your brain through your tongue. The tongue tells the brain that this is really sweet sugar, and the brain is anticipating, but the brain doesn't get to the real sugar because it was artificial. So the brain drives you more to, hey, you promised something was coming, but nothing is coming. So people who start the diet drinks, over a period of time, they need to take more and more of diet drink.
Well, it's like the low fat, healthy snack that has a healthy amount of fat.
Fat,
Yeah, you
correct,
get a healthy
yes.
amount of fat from like coconut oil or something, a good
Mhm.
source.
Exactly. So that gives you that satiety, that satisfaction.
I remember back
Correct.
in the 80s and 90s, it was all about the low fat snacks. That was such a big deal back then. People didn't know.
Zoe, I wanted to make sure that the most recent research that I want the viewers and the audience to know about this is that a lot of overweight and obesity issues of the future, they start with early infancy. Early infancy is where everything starts. Birth process is where it starts. Kids who are born by C-section and the kids who are not fed breast milk, they have a different microbiome, and that microbiome is more likely to produce obesity and other chronic conditions in the future.
Really? Now that is interesting.
Again, that is very, very important to know, because when the baby is born through the natural birth canal, they get a good dose of healthy bacteria that colonizes their gut and the skin and the respiratory tract. And that colonization with healthy maternal bacteria will determine their future. And then through the breast milk, they get all the right kind of food, the prebiotic kind of thing and the probiotic for the gut bacteria to remain healthy, and that will save them from future crises of health. The other thing is that early use of antibiotics and early use in infancy, early use of antibiotics and early use of acid cutting medications leads to obesity in the future also.
Very good to know.
And throughout our lives, the antibiotics used will damage our regular bacteria. So another thing to ask your doctor, if he's very easy or she's writing prescriptions of, you have sore throat, yet antibiotics, ask your doctor, do I absolutely need the antibiotics, doctor? We have to be careful because it can kill not only the bad bacteria, but also the good bacteria. And that will take a long time to regenerate. And that in the meanwhile can create problems for us.